Okay.
Welcome, everyone. I'm really proud and honored to introduce my friend Alan, who is from the Massachusetts College of Pharmacy and Health Sciences. It's an outstanding school in Boston, and we have a lot of happy students that fly to the East Coast and attend there. He's an expert in the medical field, and we're really honored to have him.
Thank you very much, Amy. And ladies and gentlemen, I'm sorry this is my first one. Normally, this is not that difficult, but I'm actually going to email Amy and send to her my entire PowerPoint, and she can send it out to you guys. I apologize. I had it once I figured out how to share the screen, I couldn't pull it up, but I'm so sorry about that. But you'll get what I can't show you now, you'll get certainly later. And Amy and I have worked together now for a very long time, and we really have put through a lot of students who were very eager and interested and passionate about going into the healthcare field. And they're doing very well. I know lately, never more than ever, is there a demand and an increase in not just jobs in healthcare, but majors in healthcare. It seems like every year, when I first started at MCPHS back in 2009, I got the question then, oh, will there be a healthcare shortage or is there going to be an oversaturation? Well, now it is 2020 and we are completely full in all of our majors. We cannot admit any more. Most colleges and universities right now are having a tough time due to COVID-19, but in terms of where we are, we can't admit anymore. We actually have opened our campus to give students option of going hybrid and online. And to give you an idea of the demand, we're full in housing. So I would say, in California being our largest out-of-state market, I would say that there are more kids that want to actually go and do the hybrid option where they're going to be in classes and labs a couple days a week and then some electives online from their dorms. There are more of those students interested in that rather than being online. So I had a student that I had worked with a year or so ago, and she emailed me and said, Alan, it's been a long time, no talk. I had interviewed her, and I'm going to talk about that today because I think it's really, really important, especially as the demand increases for majors like nursing, pre-medicine, PA, still even pharmacy, physical therapy, dentistry, dental hygiene. And she was interested in nursing, and I sent her to the grad and transfer department because once you have taken 12 or more credits at a college or university, whether that be a community college or somewhere else, you're considered a transfer student. So it's a different process. So I handed her off to the transfer folks, and we're already full, and she's going to have to wait a year. There's a year waiting list for nursing. So I'm really happy you could attend this because I'm going to tie in MCPHS, but it's not my focus. My focus, I'm going to use that as a guide for you guys to explain these majors, what folks like myself look for, what you should do, how to stand out in your application, in your essay. In COVID-19 right now, it's very difficult to get volunteering opportunities at hospitals and things like that, which could really make your application really stand out. But because of these barriers now, I'm going to talk about ways where you can overcome that. And no matter where you apply, and no matter what schools you're looking at, I will give you the tips and the things you need to show you how to overcome these COVID-19 barriers in this new world we live in. Obviously, you can't volunteer probably at a hospital as much as you could before and get that kind of community service. So we're going to talk about ways and bringing back maybe virtual interviews, the old way of admissions of interviews back in the day, now bringing them back in a virtual format and a platform where students in the past were a little bit nervous about interviewing. Now it's looked at as an opportunity for you to stand out during a day and age now where it's hard to, simply because of COVID-19 and the coronavirus that we're battling. Amy and I have worked together for a really, really long time. My name is Alan Beaudoin. I've been in higher ed for 14 years. I've been at MCPHS for a good 12, going on 13 years now. And when I came here in 2009, just to give you an idea of how strong the medical field is and how always and forever and ever there will always be jobs in the medical field. In 2009, America went through a housing crash and a mini recession. The auto industry crashed and a housing recession, and we went into a major recession. Prior to that, I worked at a liberal arts university as an assistant director of admissions, and it was a different time, right, Amy? I mean, back then you could get a degree and could be music, could be art, and the world was much different. IBM or General Motors had a management training program. They could hire you. You just needed that bachelor's. You didn't really need to be that well versed in IT tech or the auto industry. They would train you. They would fly you to Detroit, the auto industry. IBM would bring you to their headquarters out here in the West Coast or in New York, and they would provide you with the training you needed. They would even pay for your graduate degree, and all you needed to owe them was 5 years after you graduated. And that was really it. You could get a degree in anything. And then when I came to MCPHS in 2009, the housing market and auto industry crashed, and people, and this is not what I believe. This is me telling you what was happening. Students and parents began to look at jobs and opportunities, and one of them, and always and forever, will be healthcare. And all of a sudden, a school like MCPHS, which catered to I called it a subculture back then, because if you were a doctor or a pharmacist or a nurse, you knew of direct entry programs, but the general population wasn't really interested in it because it wasn't on their radar. But all of a sudden it was. So a niche school like MCPHS became more mainstream America in that way. And all of a sudden Amy started to see folks like me coming out to California, and she started to see more of her students interested in these majors. I think in recent years, I would say nursing has really, really gained a foothold and has really taken off. And I know that, although I'm not saying this because I don't know, but I have a feeling that maybe many of you are interested in fields like nursing and stuff. So I thought this would be a great opportunity to talk to you about this and kind of give you an idea of what we look for. I'm using MCPHS is because it's really the only comprehensive healthcare school that only focuses in healthcare. The only one that I know really in the United States that just does exactly that. It's all medicine, it's all healthcare. They are all direct entry programs, whether it is a 3-year nursing degree, you're out in 3 years, or a 6-year pharmacy or PA or PT, or an 8-year MD, DO, vet, and dental. And we're going to talk about the differences between an MD, which focuses on specific symptoms of the human body, and a DO or doctor of osteopathic medicine, which focuses on the entire body. Yet a DO can be an anesthesiologist and a surgeon, and we'll get into all of that. But let's get to the topic at hand, which is COVID-19 in the world we live in right now. And as I said in the beginning, it is very, very difficult right now to do what we could in the past to show ourselves, our competitive resumes, volunteering, things like that. So what can you do now? Well, first, before we get there, I want to talk about the courses you're going to need and the ones you're going to need to do very, very well in. And I can tell you year in and year out without fail, it's common sense, you would think, but common sense and you would think is different than reality. And what reality is every year, as I have this year, and the year before that, and the year before that, and the year before that, I've run into students who have either biology or chemistry, but they're missing one or the other. Gotta have them both. I know I've not really dealt with that issue too much with Amy and her students in your unified school district. You guys are pretty much, they keep you, counselors like Amy keep you on the ball and make sure you have that. But you would be amazed at the fact that year in and year out, I'm missing either biology and chemistry. Biology and chemistry, although biology more so medicine, chemistry more so pharmacy. Regardless, you need them both. They are the foundation of medicine. Would you believe that even if a student had a 4.0 and a perfect SAT score back in the day when there were SATs, and I'm going to talk about now SAT optional, even if they did and the student was missing either biology or chemistry, I could not admit them until they completed a biology or chemistry course. And it doesn't have to be AP or IB. It could be a basic biology or chemistry course. But you have to have that. It doesn't have to be AP. It doesn't have to be IB. I don't want to sound like a broken record, but if you can pick up what I'm putting, if you can pick up what I'm putting down here, the reason I emphasize this is because you need them both. And I do see it year in and year out, students having one or the other, but not both. So please, 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 as a matter of fact, not just myself, but any other university in the country or around the world that has medical programs, we're looking for biology and chemistry. It's the place where my eyes go first. I look immediately at your science courses. Even before COVID-19, when you could volunteer all over the world, I went first to the transcript and looked at those science courses. You've got to have those. And you have to do well at those. I like physics, don't get me wrong, but I think physics is more engineering, biology, chemistry, more medicine. For the school like MCPHS, where we're located in Boston, we actually work with Harvard Medical School. We're adjacent to Harvard Medical School, meaning we're across the street from them. And all of our students do their clinical rotations and internships through the Harvard Teaching Hospitals of Boston. I think when you're looking at a university for medicine, it is very important to look for a university that has clinical affiliations with nearby hospitals. You can only learn so much in the classroom. To be successful in this field, you really need to, as early as maybe even your freshman year, get experience with real patients, learn how to communicate with them in difficult situations, really learn to manage your time. I think a successful nurse, doctor, pharmacist, physician's assistant, healthcare practitioner does a really good job with their time management skills. It is going to be your best friend. It is going to be your ally. It is going to be the secret to your success. So guess what? One of the things we look for and I look for are your time management skills. And how can you show that? How do I know where to go to find that? Well, you have an activity sheet. You've been involved at this point, even before COVID-19, whether it was a sport, whether it was a club, whether it was an organization, if you have a job, if you are involved in a music and band and orchestra and play a musical instrument, showing that you can maintain good academic standing while involved in a rigorous course load with a plethora of clubs and organizations shows amazing time management skills. It's also going to show someone like me that I could stick you in a lab, in a classroom, in a hospital in one night and you'll be successful. Really developing good time management skills and managing your time is going to enable you to be successful. I know that sounds cliche. I know that sounds, like you hear it all the time. And it's good if you do, because it's the truth. And because in medicine, you have to take, along with your organic chemistry and your medical molecular biology and some of these courses, there are labs associated with these classes. You really are going to have to, and the types of assignments that you receive from your in-classroom lectures to your labs are completely different. And I think you can see where I'm moving now, practically applying knowledge to something. That is incredibly important. And it is the difference between those who are successful and those who are not. So what do I mean by that? I think when I came to MCPHS back in 2009, there was a really strong emphasis on SATs, ACTs, GPA, and do not get me wrong, that didn't go away. But over time, healthcare practitioners in the world of medicine began to reevaluate how they should review students who were applying to medical schools, that were applying to pharmacy schools, applying to nursing schools. A human element, a real practical approach. And what they found was fascinating. And I think you'll appreciate this because growing up in California, you are used to, if I don't have a 4.0, and now everything, including us, is an SAT or an ACT are optional now. But back in the day before they were, you were used to, well, if I don't have a perfect 4.0 in test score, I'm not going to get into college and I'm not going to be successful. In the world of medicine, don't get me wrong. You do have to have a good GPA. You got to show strength in math and science. And back in the day in the SATs, I did look at the math section more so than the English and writing section. But most importantly, I'm going to give you a case study. Let's say I had, in the world that existed with an SAT and an ACT, let's say I had a 4.0 and a perfect test score. And let's say I had a 3.4, and out of a 1600 back in the day, which this candidate to my right has the 1600 with a 4.0, let's say I had a 3.4 and an 1190. Let's throw it out there. And this 1190 and 3.4 worked really, really hard. They went above and beyond. Maybe they interviewed, maybe they showed strength, and they belonged just as much as the 4.0 and the perfect test score. Okay. I put them both in a lab. I put a muscle in front of each of them. I spray it with bronchitis and mononucleosis. Then I add erythromycin and amoxicillin to it. So what I did was I took a piece of tissue and I sprayed it with a virus, and then I added an antibiotic. And verbally, physically, I want to know what's going on and why. A lot of times the student to my right that had the 4.0 perfect test score, not always, but sometimes, maybe their learning style was best under a multiple choice exam where the answers were in front of them, and in paper and pencil or pen, they could find the answer in a series of possible questions and answers. The student to my left maybe had to work a little bit harder, took dubious notes. And in medicine, it's all about practically applying knowledge to something. figured out that the fact that when the multiple choice A, B, C, D, E, F, or G was not there, the 4.0 and the perfect test score maybe had a hard time in that clinical setting. But the student to my left that had the slightly lower GPA and test score figured out the fact based on what they learned, took notes that an allergic reaction was going on due to a hereditary gene that goes back in that family. And so by taking a blood sample and running that through labs and based on your lab results, now you can prescribe an antibiotic that's not going to cause that patient to go into a harmful allergic reaction. And that's medicine. Now I skipped a bunch of math and steps there that you would normally have to do. But in the end, that's really what it comes down to, practically applying knowledge to something. So as these healthcare practitioners and the powers that be, as they were reevaluating how we looked at high school students coming out, applying to nursing programs, applying to PA programs, applying to pharmacy programs, we began to put a little bit more emphasis on your communication, your personal communication skills, your time management skills, which was why I'm really emphasizing this, and a more human element rather than focusing on just grades and test scores. And right now in a world where SATs and ACTs do not exist, I think it's almost imperative that you, given the chance to have a virtual interview, to show these people like myself that make decisions for schools like I do, I think it's an opportunity maybe that you can't live without. And I think it's an opportunity that you must take advantage of, because a lot of the times the people that get into med school or that get into nursing school or that get into pharmacy school, there comes an interview at some point in time, and they're really looking at how you can communicate and how you can communicate with different patients, whether you're in HIV, cancer, pediatric oncology, nuclear medicine, ambulatory care, drug, whatever the case may be, whatever the specialty of medicine you may be. Some people like to work with children, so a nursing student, a pharmacy student, a PA student, an MD student working in pediatrics may be what you're looking for and advantageous. So definitely in your interview or in some way where you can showcase your personal skills, putting those interests up front and then giving examples of how you work with kids. Do you babysit? I mean, I know it sounds kind of ridiculous, but hey, we don't have the SATs right now. So you're going to have to find creative ways now to showcase people like myself that you match these criteria. And one way to do that is your essay. You know, I know Amy and counselors are going to work with you and do and have, and there's importance of your essay, what to put in an essay. I think highlighting certainly why you want to go into nursing or pharmacy or PA or medicine, you showing compassion, showing your involvement in your community, really utilizing a possible virtual interview along with your essay. Now that the SATs are pretty much optional, using those tools to make yourself competitive in the eyes of those making decisions like myself. I really think that, and you're going to work closely with your counselors like Amy, and you have to, she knows. So, and she communicates with all of us. So that's why she's doing this now for you. So it's really, really important that you understand that, and you now have to work, get away from the mindset of the SATs and ACTs to more focus on doing well in your science courses, focus on writing good essays. I mean, we use the Common App, and you know, for us, there's two essays. There's the Common Application, which gives you a series of possible, you know, questions, and you can use whichever one you want. Then we have a short answer supplement is why you want to become a healthcare practitioner. And I think the worst thing you could do there is say, I want to make a lot of money. Please don't do that. You can be a stockbroker on Wall Street or go to work in Silicon Valley or in the business world and you'll make money. Medicine is not, yes, you become financially independent, but you're serving the greater good. Most importantly, these are people's lives in your hands. So it's a very serious thing. So you really want to show in those opportunities, which I look very, very closely at that short answer supplement, is why you want to become a healthcare practitioner. I'm really looking for your compassion for people, the true reasons is wanting to help people, because medicine is the kind of thing where it's not a jacket that you put off and you put on and go out the door and then you take it off when you get home. You know, it's a lifelong commitment, and the education can be long as well, especially if you want to go to med school or vet school or dental school. So it's a very, very, there's a lot of commitment that goes there. And again, that's why I'm saying and emphasizing, and these are all inside information tips here, time management skills, developing those. That's really how you're going to juggle labs, clinical rotations, your courses. That's really going to be the secret of your success. So really showing folks like myself who make decisions on these applications why you want to go into medicine is extremely important. Um, I think when you look at programs like whether it be dental hygiene or whether it be going into dentistry, certainly nursing, MRI, radiography, radiation therapy, pharmacy, biology, public health, even health psychology, and certainly vet and MD and DO, they all share one thing in common, and that is working with human beings and getting comfortable working with human beings and developing just as many communication skills as math and science grades. Really, really work on that. Maybe practice interviewing, get comfortable talking in front of people, talking with people. There's a huge emphasis on that now more than ever because at the end of the day, for example, at MCPHS, we practice a type of education that is very interesting. It's called intraprofessional education, IPE. And to give you an example, the collaborative nature of MCPHS is unique as such, where our health psychology majors, for example, will work with our dentist students and our dental hygienist students. How many times do you go into the dentist office and anybody getting a drill in their mouth, or anybody getting a root canal, or whether braces back in the day, now Invisalign, whatever the case may be, getting a cap or a crown, there's going to be a pinch, there's going to be some numbness, there's going to be some pain. I don't care how old you are, how young you are, no one looks forward to that. I mean, thank God dentistry and the dental technology has gotten much better than it was before. So understand, a dentist or a dental hygienist, the best, truly understands how people feel before they sit down in that chair, and how you treat that patient and how you make them feel at ease. We call it bedside manners, is going to make or break you as a good healthcare practitioner versus one that isn't. So our healthcare psychology students are always working with our dental students. They're always working with our medical students, our pharmacy students who give students shots on campus, who are working with nursing students whether someone's coming in to have a baby, or sadly cancer or HIV or cardiac arrest or heart disease, or they just don't know what's wrong with them. Could be pneumonia, and some people think the worst. I mean, that's the common psychology of a human being. You really have to understand where these people are coming from, and that these are uncomfortable situations, and making people feel at ease is going to really, really set you apart from becoming a good healthcare practitioner versus not. And in many ways, really have to understand that. So our healthcare psychology students are always working with all of our students to kind of remind them of that and say, hey, we work, my field is we're treating people every day in a different way, but it's really important that you have to understand where they're coming from and that will enable your treatment to be that much more effective. Absolutely, definitely. So it's called IPE. I think that when it comes to nowadays, and I talked about it in the interview, and I've noticed the last couple of years, and Amy, correct me if I'm wrong, nursing in itself has become very, very popular and very, very much in demand. And one of the most applied majors that there is today, more so than there was 5 years ago, 4 or even 3 years ago. I want to talk to you about early action, early decision, regular decision when it comes to these majors. When you look at competitive majors like medicine, it's often advantageous to personally, and it depends on the individual. I personally like early action over early decision because early action is not binding. That means typically, historically, and you want to check with every college and university, because even though it's the same at a few places, it may differ and there may be stipulations. So you definitely want to check and make sure. But historically, early action is not binding. Early action or early decision is. And early decision is great if that's the school you want to go to. You've applied, you've been admitted. this is it. You're going to withdraw all your other applications. Congratulations. And that's great. If you want options and you really want time to think about it, and hopefully by the spring of next year, COVID-19, if we knock on wood, cross our fingers, it lifts, you guys can visit these schools, maybe, hopefully. We'll see where that stands. But let's say it does. Well, then, if you're one that really wants to wait until you do visit, because historically, I think everybody's experience is much better when you visit before you commit. I'm always telling my students, some that even want to commit before they visited, please wait a minute. I really would rather have you get on a plane, fly to Boston, see our campus before you commit, because I want to make sure this is what you want to do. If you're one that does, and we look at these competitive majors, and they are getting even more competitive, and I have a feeling they're going to be even more so next year, it may be advantageous looking at an early option, especially like us, in which we have early action. So you're not binding, you don't have to commit, regardless of how high a scholarship you've got or direct entry into the program. You have options to wait, you have wings, you can look at other schools, you can apply to other schools. But I want to throw that out there to you, because I'm telling you this because, as I said before yesterday, I hadn't talked to a student in a year who I interviewed in Los Angeles for a nursing spot back in the fall of 2018. And she didn't forget about me, and she emailed me and said, I've spent a year at either a community college or Cal State or UC, and now I want to transfer into the nursing program. So with that, it tells me that, okay, this isn't going away. These majors are still going to be even more so competitive because there is a huge demand for them. With that, maybe looking at an early action, and of course, have a conversation with your counselor like Amy, and strategize there, but maybe applying to these majors might be advantageous early. Of course, not binding being the best, just to give yourself a chance, I think, because I think they're going to be even more so competitive as time goes on. So one of the things that you might want to ask these admissions counselors as you're applying to these schools for these majors is, do you have an early action or early decision? And if you have both, which is binding, which is not, is your early agreement binding? Is it not? Regular decision is okay, but just to give you an idea, at MCPHS, let's say a student applies early action, which is November 1 or December 1 always, and they hear back by mid-December of this year, 2020, they have till May 1 of 2021 of next year to let me know what their plans are, and I don't interfere. I don't push them one way or another. Even if a competing applicant applies with a slightly higher GPA or test score for the same major, but we've filled our quota, too bad. That competing applicant has to go on a wait list because we're first come, first serve. And I think that's the fairest thing to do when you have so few spots. And remember, these majors are all licensed, along with a nursing degree, a pharmacy degree, a medical degree, right? You're going to get a medical license, which is going to board certify you to practice in the field of medicine. One of the reasons why they are so competitive is you can't saturate the job market. We are held accountable by the accreditation board in Chicago. We have to show board pass rates, job placement, and retention. 98% of our kids pass their boards, 100% get jobs, 80% go to med school, vet school, and dental school. If we admit one more student this year in any one of our majors, which we're full, then we're breaking those rules. We're kind of inflating the candidates into a job market, which there's only so many jobs. It's not like majoring in a liberal arts school. There are laws, rules, and regulations that we have to follow. That's why it's so competitive. So with that being said, I really encourage you, maybe once you've identified the schools you want, knowing these majors are competitive, apply to them early if you can. And again, making sure and working with your counselors, making sure, knowing which ones are binding and which ones are not, and making sure that's explained to you up front. That's very, very important. Moving on, I think that when you look at the application and you look, and some schools have their own application, some use the Common App. We use the Common App. We don't charge application fees. I think as you apply, not only identifying which, if they have an early or not, which is binding, if there are options to, as I've mentioned before, maybe do an online interview. Just make, it's always, think about it as applying for a job. Everybody has a cover letter and a resume. And sometimes in the workforce, if your cover letter is good, they'll get to your resume. Sometimes if it's mediocre, they'll talk, and even though your resume is phenomenal and you're the right candidate for the job, if you can't get their eyes past that cover letter onto your resume, you're not going to get an opportunity to interview for the job. Now with the SATs and ACTs not happening, and that's okay. Again, find creative ways to get in front of people like myself. Ask for an interview. Show these people why they should admit you, and probably they should. Show them why. I think this is an opportunity for you. Remember one thing: nothing comes to us. We have to go after it. We have to pursue it. Nothing falls in our lap. Nothing. Whether it's a job, whatever the case may be, a house or a condo someday, you have to go out and you have to get it. And I think now more than ever, without the SATs and ACTs, showcasing yourself and giving yourself the opportunity to get in front of decision makers is only going to increase your chances, I do believe. Definitely. Absolutely. I can't speak for everybody. We're, for the first time, well, I've been here for 13 years. The school's been around for 200 years, and it is the first time in its history that we're SAT, ACT optional. So I know if we are, and we're all medical, and previously that's a standard, I'm thinking and assuming a lot of places are. I don't want to say that. You want to check, but I'm just saying I have a feeling that most places are. So again, getting creative, recapping what we talked about, finding out, okay, once you've identified your school, do they have, especially if it's nursing, definitely, pre-medicine, MD, DO, vet, dentistry, pharmacy, PA, very competitive. Try to apply early if you can, and find out if they're binding. Really showcase the passion that you have for their program, their major, the world of medicine in itself. In your essay, that essay being very important. Request if there is an opportunity. Many schools may not offer that, some do. I always do, because whether in non-COVID years or in COVID years, I think there's value in an interview. It really shows, because for somebody like me, who reads hundreds of applications and essays, it's very different when I meet somebody face to face and get a sense of who they really are and their ambitions. It certainly makes a world of difference. So, but don't even wait for somebody like me to connect with Amy. Just work with Amy. Amy communicates with all of us. I think if you have the opportunity to do that in a world like today, that you should. When you're looking for these schools and these majors, I think it's very, very crucial that they have a nearby hospital or such. One of the advantages of our school is the fact that it's surrounded by Harvard Medical School, and those teaching hospitals are like right out the front door, and one of them is attached to our university. You can walk through the halls of it without even going outside. So being able to have resources to really gain real world practical experience is very, very important. To give you an example, and those of you that are interested in medicine, I talked about it earlier. There is MD, which focuses on specific symptoms of the human body. Then there's something called Doctor of Osteopathic Medicine, the individual that focuses on the entire body. Let's say I have a sore throat. The MD is going to treat the pain, and I point to my throat because that's where the pain is. Okay, the Doctor of Osteopathic Medicine is going to go a step further. They're going to figure out the fact that mucus from my ear, I know this is gross, but it's medicine, sometimes we got to get gross, is dripping in a liquid form from my ear to my nose. And typically when it gets to this point, we're able to blow it out in a napkin or something and throw it away. Well, at this particular stage, it's bypassing my nose, dripping into my throat. We call that postnasal drip. Now, when that is kind of yellowish, it means that you have an upper respiratory infection. When it turns darker and greenish, it means you have pneumonia. When it's kind of brownish, it's bronchitis. So really the DO is going to treat the entire body. Now a DO is a surgeon. They are a pediatrician. They're an anesthesiologist. Just to kind of dive into what an anesthesiologist does, let's say I'm having brain surgery and Amy is the anesthesiologist. She's gonna run a couple series of tests on me, and she's gonna measure my sugar, my salt, my blood levels. If for some reason on my charts they go past her benchmarks, where it's in the danger zone, where if the surgeon, because she's got the power as the anesthesiologist, she says to the surgeon, yes, they're operating on me. If if those levels are correct. If my levels are higher than our benchmark right here, by cutting me open, that could increase them even higher. My blood level can raise, it can cause me to go into cardiac arrest and die and have a heart attack. So she's going to inject me with fluids to bring my level down. And when she's satisfied with what she sees, then she's going to notify the surgeon and say it's okay for you to operate on Alan. So that's what, real quickly, what an anesthesiologist is in so many words. And that's just one example. Um, but a DO can be an anesthesiologist. At MCPHS, one of the growing, and all over the country, one of the growing majors aside from nursing, there are two. BSMD, a dual Bachelor's of Science to medical doctor. They are typically 8 years long, right? The first 4 years are undergrad. The final 4 are med school. They typically do want to see an MCAT. The score doesn't have to be, ridiculously high due to the fact that you're taking prerequisites to med school along with clinicals and internships. So you're getting kind of a break there. And in general, and that's the good thing about a BSMD, the fact that you're assured a spot once you meet criterias, regardless. Once you meet the criterias that you have to, you're assured a spot in med school. In that, can you apply to other med schools? Yes, you can. Yes, you can. And oftentimes it alleviates pressure from an applicant because they're already going or in a med school program. And when they interview at med schools, oftentimes saying, I'm already in a med school program, so what does your school have to offer to me? Now you've tipped the scale of power and it's now in your favor. And now that the med school that you're applying to knows you're already in, then they become interested in you because you're already in med school. So that's the value of the BSMD program. The BSDO program, there is no MCAT required because it's more holistic. They don't require that. Now, how does that work at schools like mine? And other schools have them across the country. How that works is there are interviews required in those majors. You apply and you're admitted. Then, pre-COVID-19, you would get on a plane. Let's say you applied here or applied for school in Oregon or Washington. You would fly there. You would then have an interview for the remaining 4 years. You're already in with me for the first 4. If you pass your interview, then upon arrival home, you will get a second acceptance letter to DO school, med school, no MCAT, you've got all 8 years in your hands. For those programs, especially the BSMD, the BSDO, I think any direct entry pharmacy program, especially a nursing program, consult with your counselor, you're working with them. This is just advice. They know more than me in that regards. It may be advantageous to think about applying early, definitely knowing the nature of competition that goes along with those majors. When you look at med school, and people always ask me, how do you get into med school? I've had a pretty good, successful track record of students getting into med school. Experience, experience, experience. One of my students who was in my BSMD program, again, having the luxury of having hospitals out your front door, especially Ivy League teaching hospitals like Harvard Med at MCPHS. Ethan Doe from Orange County, California, was able to penetrate them. And he started out volunteering. It wasn't a paid internship. A doctor took him under his wing. One thing led to another. He was published in a medical journal. The next thing you know, now he's completing medical school at Georgetown University. One of the things that he told me and he said to me was, his first day years back, I called him in September to see how he was doing. And he's a smart kid, worked hard, much like all of you. Went to a good school like Prospect, and the school's in your unified school district, had good grades, had good counseling, had good teachers. Went to a good undergrad school, good grades. But the one thing he told me, and I want you to remember this, he said when he got to med school, that there were, out of 100 people in his class, there were only 5 of them that were under the age of 25 that had graduated with a 4-year degree and that were going to med school. Everybody else in there had a higher degree and they were going back to school above the age of 30, which means maybe in a previous life they were a teacher. I know a pilot that quit and went to dental school. What I'm saying is you're going to have older people with experience in here. So what med schools are really looking at is not just grades and MCAT scores and things like that. They're looking at experience. That's why I alluded to earlier. It's really important when you choose, I think, of going to study any one of these majors at a college or university, that you do have access to a hospital that you can get experience, because that's just as important as it is the grades they're both important, but they're really looking for experience because typically and quite often you may be in class with an older student with experience, maybe the PA, maybe the mom who wanted to be a mom. She wanted to be there when her kids were young. So she became a physician's assistant. Why that's so important is because, well, in the long run, you make just as much as an MD, a surgeon, an anesthesiologist, a DO, but you're not in school for as long. For some people, that's important if they want to have a family early, so they can do that, be there. This young lady that I know was a PA because she wanted to not send her children to daycare, or she wanted to kind of be there. It was very important for her to raise them. You know, her husband was an accountant. He worked in the at day. When he came home at 5 o'clock, she would hand off the kids to him and she would go to the hospital and work the night shift as a physician's assistant. A physician's assistant is not in school as long as an MD, a DO. They can perform surgery alongside with the supervision of an MD, but they can check out, they can work a 9 to 5. They're not expected to stay in the hospital overnight, be on call all the time. If they work for a privately run doctor's office, they can still work 9 to 5. It's not their job to track down patients' medical insurances to make sure the bill's been paid. So with that being said, PA is very popular. You have a lot of former pharmacists and PAs that go back to med school later once their kids are older and they're in the first and second and third grade. So these people have experience. They're already healthcare practitioners. That's why I think it's the best route is a BSMD or a BSDO, but make sure you can get experience because your competition is already going to be steep once you get there. They already have a degree, they already have a license, and they have something to add to the conversation in those classes. So those that are making decisions want to really know how you can keep up. The pace is going to be quick, it's going to be fast. So you want to have experience to speak on behalf of to keep up. That's really one of the biggest, that's an inside tip right there. Not a lot of people would mention that, but I'm telling you now, this is what they look for. I would know we're gonna, oh, yeah.
Sorry to interrupt, and I love it that you bring up experience because you're right on the money there. I just want to let you know there's 10 minutes
Mhm.
and maybe we should open it up for questions.
Perfect.
I'm going to stop recording now.